أعوذ بالله السميع العليم من الشيطان الرجيم من همزه ونفخه ونفسه بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. Alhamdulillah Rabbil Alameen. Of course, now we're doing our Ramadan special for 2011. Today is part 3 in that special. Now, today we're going to do something we've never done before, which is talk specifically only about diabetes in Ramadan for one entire segment. And the topic today is diabetic concerns in Ramadan. As you know, diabetes is on the ever-rising increase in the UAE, specifically in the world in general, so it deserves a program by itself. And for that, we need a specialist in that area, and Allah has provided one for us today. Our special guest is Dr. Ajaz Yasmin.
Ajaz Yasmin, yeah.
Yes, who is a specialist in internal medicine and diabetology at Belhul Specialty Hospital in Dubai in the United Arab Emirates. Dr. Ajaz, assalamu alaikum.
Wa alaikum assalam.
Of course, first time I've met you, we spoke by phone and this and that. Very happy to have you. This is your first time on our program, Medicine and Islam. So you could please just tell our viewers a bit about your training and your background.
Yeah. I have graduated from the northern part of India, the Kashmir University, in the year 1998. After that, I took the Masters in Internal Medicine. And I was practicing as a specialist in diabetes and internal medicine in that place. And I moved to UAE in the year 2006, and I joined Dubai Health Authority. And I have been with the Rashid Hospital in the diabetes team as a specialist since then. Okay. And of late, from the last 1 year, I have joined Belhul Specialty Hospital. I did my post-graduation in diabetology from Cardiff University in the UK. And I have been practicing diabetes from the last around 10 to 12 years.
Well, very good. So you were in the UK for some time as well. Very good. Very, alhamdulillah. Very happy to have you. You must be a busy man. Diabetes is really such a problem.
Yeah, in this place, in the UAE, the prevalence of diabetes is around 20%. It's second highest in the world. Yes. One small island in Western Australia is the highest incidence. With the population, there's around 50,000 only. But this place, we have a population of around 3 million, and out of which 20% are diabetic. That means every 5th person is a diabetic. And on top of it, if you see the pre-diabetes, those patients have increased risk for diabetes. Again, these people are around 20%. That means every 3rd person either has a risk of diabetes or they are diabetic.
They either have it or they're in danger
of
getting
they are in danger in the coming years, in the coming 2-3 years.
This is almost sounds like an epidemic.
Yeah, it's an epidemic. And
unbelievable.
And particularly all the Gulf countries, all 5 are on the top list.
Yes. It's not just the Emirates, of course. It's GCC in general, but the Emirates is at the
topping
top of
the list.
Unfortunately.
For the wrong reasons.
We're number 1 in many things in this country. This is not one we're particularly happy about. Thank you so much. Now, let's talk about, of course, there are 2 main types of diabetes. Let's talk about, the first type, type 1 diabetes. What exactly is type 1 diabetes? And in your experience, roughly, what percentage of these patients are able to fast in Ramadan, if any?
Yeah. Type 1 diabetes basically is an insulin dependent. Okay, previously it was called IDDM, that means insulin dependent diabetes mellitus. But now they call it type 1 to be more precise.
Okay.
It basically results when the cells which produce insulin in the body, which regulates your blood sugar, they are destroyed. Okay, so when the beta cells of the insulin, which produce the insulin, they are destroyed, what happens? The blood sugar is not regulated. The blood sugar becomes very high, which in turn leads to weight loss, it leads to more thirst, it leads to passing more urine, and these symptoms, these patients come to us. And this type 1 diabetes occurs mainly in the early years. It was previously called the juvenile, but sometimes it can occur in the later age also, which is called the this autoimmune diabetes of the adults, which can present. But this form of diabetes is very severe because you don't have any insulin left. So the patient is dehydrated, he loses weight, he passes more urine, and the parents come to us that my child has lost so much of weight. He's always going towards the kitchen to eat food, and he's always going to the washroom. And regarding how many percent fast during Ramadan with type 1 diabetes, there was one study which was conducted in 13 Islamic countries in 2001 in around 13,000 diabetic patients, where they found that around 40% of type 1 diabetes do fast.
40%?
40%. It's amazing figures.
That's more than I thought.
Yeah. And out of which they saw how many days they could fast. They fast from 10 to 15 days, alhamdulillah. Such a big number. But if you see in Quran, it's clearly mentioned those who are sick need not to fast. In Surah Baqarah, verse number 185 to 186, it clearly mentions.
Yes.
But in spite of this, it's a challenge for the physician. Particularly in this part of the world, they come to us, they say, okay, the Ramadan is coming, we have to fast. We tell them, no, your sugar is not controlled, this and that, but they are not adamant, they do fast.
Okay.
So it is a challenge for the physician, it's a challenge for the community, and it's a challenge for the patient also.
Okay. Now you mentioned one word which kind of got my attention, which is autoimmune. What destroys the pancreas? Is it an autoimmune disease?
It's basically an autoimmune. There are different theories, but still we are not sure what is going on. It can be genetic, there is genetic susceptibility. Some say that it is a viral infection. Some viruses can affect it, autoimmunity. Yes. And of late they say those children who drink cow's milk from the cow, they have an increased risk of getting type 1 diabetes.
Some studies have shown
this. Yeah, definitely.
Okay. As opposed to those that were breastfed?
No, as opposed to those are breastfed. They say those cow's milk, because it contains a lot of proteins, a lot of antigens, and the autoimmunity may be aggravated by this.
It kind of triggers autoimmunity.
Yeah.
Unbelievable. But up to 40%, have been shown to be able to fast.
In this study, definitely. There's been shown that around 40% of type 1s do fast, and around 80% of type 2 diabetics do fast.
Very good. We're going to come to the type 2s in a minute. Of course, the type 2 diabetics is the majority of diabetics. So we have to talk a little bit more about that. But before we move on to type 2 diabetes, one more question about type 1 diabetes. Okay, since they are insulin dependent, hypoglycemia is always a threat and a concern, as well as hyperglycemia. But hypoglycemia can happen so fast. It can be dangerous. What advice can you give to this group of diabetics who may be watching this program?
First and foremost, those patients who are on multiple insulin injections, 3 to 4 injections, should not fast. Okay. And those patients who have a poorly controlled sugars, they are getting recurrent low sugars, or they are getting recurrent high sugars.
Rebound.
Okay. Or those patients who are not able to monitor their sugars at home, they should be highly motivated, type 1, who are ready to monitor their sugars at home. Or those patients who had a diabetic ketoacidosis, in the last 3 months, they should not fast.
Now that's once when the blood sugar
goes very, very high. They should not fast. So whenever we have a patient of type 1 diabetes who is willing to fast, we should do a pre-Ramadan counseling. He should report to his physician, to his internist, before around 1 to 2 months before, and tell them, I have decided to fast. So he gets a window period of optimizing his glycemia, optimizing his blood sugars. So before 2 months, we should try to make his blood sugars optimal, so that he doesn't go into hypers or hypo. And we have to modify his diet, his other things. We have to modify the diet. We have to modify the injections. If somebody is doing 4 injections, we recommend only 3 injections. 1 before suhoor, short acting. 1 before after this meals, sunset meals, and 1 late in the night. So there needs to be a lot of modification in patients of type 1 diabetes who need to fast. And one thing is that if he gets hypoglycemia, they say generally less than 60 milligrams per deciliter. But in UAE there are different values. Some use milligrams, some use millimoles. So millimoles means 3.3. Any sugars less than 3.3 or sugars less than 60, they should break their fast immediately. Or if somebody in the first 3 hours after he takes his food, the blood sugar is only 70, they should also break their fast.
They won't make it through the day.
They won't make it through the day because there will be a lot of complications. They can go to dehydration, they can go other problems. If the sugars become high, they can go into diabetic ketoacidosis.
The interesting thing about this disease is that both extremes can kill you.
Hypo is more dangerous, because some type 1 diabetics, unfortunately, they don't have the awareness, hypoglycemic awareness, which is normally present in a normal person. Once the blood sugar goes low, there are other hormones which come. Glucagon goes up, the growth hormone goes up, the steroids go up, which maintain your blood sugar. But unfortunately, in patients